Hello students, in the today's session we'll talk about pharmacology of CNS stimulants. CNS stimulants are the drugs that stimulate the brain, speeding up mental and physical processes. They increase energy, improve attention and alertness, elevate blood pressure, heart rate and respiratory rate. Now at high doses they can produce convulsions. Now classification of CNS stimulants. First category of drugs are called as convulsions. For example, strychnine, picrotoxin, bicuculline, pentylene tetrazole. Second category of drugs are the analeptics. Those drugs that increase the respiratory rate and are found to be useful in the treatment of apnea, for example, doxapram. Third category of drugs are very important and these are termed as the psychostimulants. These drugs predominantly produce stimulation of central nervous system. Their other effects like the effect on respiration is not that prominent, is not that important. For example, amphetamine, methylphenidate, atomoxetine, modafinil, armodafinil, pimoline, cocaine, caffeine. These all are psychostimulants. Now we will talk about the pharmacology of convulsions. First drug is the strychnine. It is a spinal convulsant. It induces tonic-clonic convulsions. Strychnine is a natural alkaloid. It is obtained from the seeds of Strychnus nux-vomica. It blocks postsynaptic inhibition mediated by glycine. Glycine is a inhibitory neurotransmitter and strychnine blocks the postsynaptic inhibition which is mediated by glycine. Currently, strychnine is not in use. Another convulsant is a picrotoxin. It is a medullary convulsant. It induces clonic convulsions. It also blocks presynaptic inhibition mediated by gamma-aminobutyric acid. Gamma-aminobutyric acid is an inhibitory neurotransmitter. And inhibition of this inhibitory neurotransmitter causes CNS stimulation and induction of convulsions. Picrotoxin has no therapeutic indication. Another convulsant is a bicuculline. It is a competitive GABA A receptor antagonist. That means it inhibits neurotransmission induced by gamma-aminobutyric acid, and by inhibiting GABA it stimulates central nervous system and it induces convulsions. It is used as a research tool. Another convulsant which is commonly used in the pharmacology laboratories for inducing convulsions is the pentylene tetrazole. It is a powerful CNS stimulant. It produces direct depolarization of central neurons. It blocks presynaptic inhibition mediated by GABA. And as I have already told you, pentylene tetrazole, it is used in the laboratories for inducing convulsions. And antagonism of pentylene tetrazole induced convulsions is an established method, is a well-known method for testing the anticonvulsants. Now we will talk about the pharmacology of analeptics. Analeptics are respiratory stimulants. They stimulate respiration, and these drugs are of resuscitative value, that is, they causes revival in fainting and coma. They show a narrow margin of safety, that is the difference between therapeutic dose and the toxic dose is very narrow, very less. If the doses are exceeded at high doses, they can induce convulsions. And use of ventilator is more effective and safe compared to analeptics, and therefore the utility is dubious. And these analeptics should only be used if mechanical ventilators are not available. Now, drug under this category is the doxapram. Doxapram promotes excitation of central neurons. Low doses are more selective for respiratory center, and by stimulating the respiratory center, it causes rise in the rate of respiration. It stimulates carotid and aortic body chemoreceptors, which convey the message to the respiratory center, which is located in medulla oblongata, and once the respiratory center is stimulated, there is increase in the rate of respiration. And doxapram is used for the treatment of apnea, that is the temporary cessation of breathing. Continuous IV infusion may abolish episodes of apnea in premature infants not responding to theophylline. Side effects include rise in blood pressure, high heart rate, vomiting, tremor, sweating and convulsions. Now we will talk about the pharmacology of psychostimulants, that is the third category of CNS stimulants, psychostimulants. These drugs, they show predominant cortical action, that is the predominant effect on the cerebral cortex, and their psychic effects are more prominent. Their CNS stimulant effects are more prominent compared to the effect on rate of respiration or the ability to induce convulsions. The first and the most important of all the psychostimulants is amphetamine. Now, amphetamine is a cerebral stimulant. It is a central sympathomimetic, and the main function of amphetamine is to increase the levels or increase the availability of norepinephrine and dopamine at the synaptic cleft. By increasing the levels of norepinephrine and dopamine at the synaptic cleft, it acts as a psychostimulant. It acts as a CNS stimulant. Now, in order to understand mechanism of action of amphetamine, let's first study the mechanism of adrenergic transmission. Now, this is the adrenergic neuron I have made over here. Now, the norepinephrine or the noradrenaline is stored in this synaptic vesicle. Now, as soon as the action potential arrives and reaches the adrenergic neuron, this adrenergic neuron gets depolarized and there is a release of noradrenaline or norepinephrine in the synaptic cleft. Now, this norepinephrine or the noradrenaline, it binds to its alpha and beta receptor, produces this pharmacological effect, and after that, norepinephrine is metabolized by the enzyme catechol O-methyl transferase. So, a part of norepinephrine is metabolized and partly this noradrenaline, it is taken back into the adrenergic neuron. So, this noradrenaline or the norepinephrine is taken back or it is transported back into the adrenergic neuron with the help of norepinephrine transporters. And further, this norepinephrine is further transported into the synaptic vesicles with the help of a transporter called as vesicular monoamine transporter. So, this is about the adrenergic transmission. Now, similar is the dopamine transmission. Now, once the dopamine is released from the dopaminergic neuron, dopamine binds to its dopamine receptors, that is the D1 and D2 receptors, produces a pharmacological action. Then partly dopamine is metabolized and partly it is taken back into the dopaminergic neurons with the help of a transporter called as dopamine transporter. So, this is about the adrenergic transmission. Now, what amphetamine does is this, that it increases the levels or it increases the availability of norepinephrine and dopamine at the synaptic cleft. And by increasing the levels of norepinephrine and dopamine at the synaptic cleft, it acts as a psychostimulant. It produces the CNS stimulant effect. Now, let's see the mechanism of amphetamine in this diagram. Now, again, this is the adrenergic neuron. And once the adrenergic neuron is depolarized, the noradrenaline is released into the synaptic cleft. Now, what amphetamine does is this, that it increases the availability of norepinephrine and dopamine at the synaptic cleft. Now, how amphetamine does that? Let's see to it. Now, once amphetamine is administered, availability of amphetamine is more outside the cell, whereas availability of noradrenaline is more inside the cell. So, amphetamine, once it is administered, it enters inside the adrenergic neuron by utilizing the norepinephrine transporter. So, Amphetamine, by utilizing the NET, that is a norepinephrine transporter, it enters inside the adrenergic neuron, and further it enters the adrenergic synaptic vesicles utilizing the transporter, that is a VMAT2, that is a vesicular monoamine transporter. So the amphetamine, when administered, it enters inside the adrenergic neuron, and further it gets stored in the adrenergic synaptic vesicles. Now there is this amphetamine which is now present inside the synaptic vesicle. What it does is this, that it pushes the norepinephrine from the synaptic cleft into the cytoplasm. So amphetamine displaces norepinephrine from the vesicles into the neuronal cytoplasm, and further this norepinephrine, it is released from the cytoplasm into the synapse utilizing the norepinephrine transporter. This is called as a reverse transport. That is, instead of transporting noradrenaline inside the adrenergic neuron, now because of the amphetamine, because of the increased availability of amphetamine in the synaptic vesicle, the amphetamine. Now this slide talks about the pharmacology of amphetamine. Amphetamine releases noradrenaline from adrenergic neurons and dopamine from the dopaminergic neurons. It increases the levels of noradrenaline and dopamine at the synaptic cleft. Amphetamine blocks neuronal reuptake of noradrenaline and dopamine. This we have already discussed. Amphetamine also inhibits monoamine oxidase. Monoamine oxidase is an enzyme which is responsible for the metabolism of amines like the dopamine and the noradrenaline. So amphetamine also inhibits monoamine oxidase, thereby increasing the availability of norepinephrine as well as dopamine. And by increasing the levels of norepinephrine and dopamine, amphetamine induces alertness, increases concentration, attention. It produces euphoria, that is a feeling of well-being, talkativeness, and it also increases the work capacity. Amphetamine stimulates the reticular activated system, and which is responsible for wakefulness, and therefore it is used in the treatment of narcolepsy. And amphetamine temporarily improves athletic performance. And as amphetamine can be consumed by athletes in an attempt to enhance their athletic performance, amphetamine is included in the list of dope test. It is included under the list of drugs which are tested for the dope test. Amphetamine also causes inhibition of hypothalamic feeding center, and therefore it also causes fall in the appetite. Now coming to the side effects, it causes a rise in the blood pressure as it is a CNS stimulant. It causes palpitation. It can cause arrhythmias, vomiting, abdominal cramps and muscular collapse. At high doses, it can also cause convulsions and coma. Now important consideration, amphetamine can cause tolerance. On repeated consumption of amphetamine, comparatively higher doses are required to produce the same response, and thus amphetamine can cause tolerance, and it can also cause psychological dependence. It is one of the drugs of abuse. Coming to the indications, it is indicated in attention deficit hyperactivity disorder, that is the disorder characterized by fall in concentration, inattentiveness, restlessness, hyperactivity, impulsivity and all. And amphetamine is found to be useful in attention deficit hyperkinetic disorder because, as we have already seen, it induces alertness, it causes increase in concentration, it increases the attention, it increases the work capacity, and therefore amphetamine is useful in the treatment of attention deficit hyperkinetic disorder. It is also useful in narcolepsy. And narcolepsy is a chronic sleep disorder which is characterized by daytime drowsiness, Since amphetamine stimulates the reticular activating system, which is responsible for induction of the wakefulness, amphetamine is useful in the treatment of narcolepsy. And it is also an appetite suppressant, as it causes inhibition of hypothalamic feeding center responsible for the fall in appetite. Amphetamine is also one of the appetite suppressant. Next, we will talk about the pharmacology of another psychostimulant, that is a cocaine. Cocaine is also a psychostimulant. It is a CNS stimulant. Now, what the cocaine does is this adrenergic transmission we have already discussed. Now, what the cocaine does is this, that it blocks the reuptake of noradrenaline, and it also blocks the reuptake of dopamine. It blocks the reuptake of noradrenaline or the norepinephrine in the adrenergic neurons by inhibiting the norepinephrine transporter, and it also inhibits the reuptake of dopamine into the dopaminergic neurons by inhibiting the dopamine transporter. So cocaine inhibits norepinephrine transporter, it inhibits dopamine transporter, thereby inhibiting the reuptake of norepinephrine and dopamine. Thus, like amphetamine, cocaine also increases the availability of dopamine and noradrenaline at the synaptic cleft, and therefore it acts as a CNS stimulant. So, cocaine is a prominent CNS stimulant. It induces sense of well-being, it delays fatigue, it increases power of endurance, that is, it increases athletic performance, it increases the physical stamina, and therefore again the drug can be abused. Cocaine, as we have already discussed, it blocks norepinephrine transporter, that is NAT, and dopamine transporter, that is the DAT. It blocks reuptake of norepinephrine and dopamine. It also causes stimulation of vagal center, resulting in bradycardia. Now these centers are present in the medulla oblongata. So cocaine also can also stimulate vagal center, resulting in bradycardia. It can stimulate vasomotor center, which causes vasoconstriction, that is the constriction of blood pressure, which results in increase in blood pressure. It can stimulate the vomiting center, resulting in nausea and vomiting. It can also stimulate the temperature regulating center, causing rise in blood pressure, rise in the body temperature, that is the pyrexia. And important consideration with regards to cocaine, it can also induce psychological dependence, and it is also one of the drug of abuse. Now, this slide talks about the pharmacology of another psychostimulant, that is a caffeine. Caffeine is found to be present in coffee. And what caffeine does is this, that caffeine causes mental alertness, and it also induces wakefulness. So, caffeine is a CNS stimulant. It is a psychoactive drug. Now, in order to understand the role of caffeine in inducing wakefulness, let's study the physiological role of adenosine in the induction of sleep. So, extracellular concentration of adenosine increases during wakefulness. That is, when a person is awake, and as the duration of wakefulness increases, there is increase in the level of extracellular adenosine. Now, this adenosine binds to adenosine A2A receptors, and it induces the sleep. So, when the adenosine binds to its adenosine 2A receptors, there is induction of sleep. Now, what the caffeine does is this, that the caffeine blocks A2A receptors and it induces wakefulness. So, this is the main mechanism of action of caffeine, that caffeine blocks adenosine 2A receptors and it induces wakefulness, and because of which there is increase in the mental alertness. So, caffeine produces sense of well-being, alertness, it allays fatigue, it reduces fatigue, it improves performance, and it also beats boredom. Side effects of caffeine are insomnia, agitation, anxiety, dizziness, diarrhea. It can increase the thirst, it can increase the frequency of urination, it can produce fever. Seizures can be produced at a very high dose. Psychosis also at a very high dose. It can produce cardiovascular system effects like dysarrhythmia. At very high doses, it can produce myocardial infarction and cardiovascular collapse. However, these side effects are not seen at the low doses. Uses of caffeine. Caffeine is mainly used for inducing mental alertness and for inducing wakefulness. Now, it is included in the analgesic mixtures for headache. In combination with the ergotamine, it is used in the management of migraine. And since caffeine is a CNS stimulant, it also stimulates the rate of respiration, and therefore it is also used in the management of apnea. That is a temporary cessation of sleep apnea. It is used for the management of apnea in premature infants. So this is all about the pharmacology of CNS stimulants. Thanks for watching the video.